She mentioned current and former users of injection and drugs, and we have a graphic that's going to show that as well. Can you talk about these a little bit?
Yes, definitely. So this is a great little summary table of some of the recommendations for screening people for hepatitis C. Most importantly are the baby boomers, anybody who's ever used intravenous drugs once. Dialysis patients are often exposed to blood products and are at risk for hepatitis C. Clotting factor concentrates, we talked about the hemophiliacs before. Anybody that has abnormal liver tests, even the tiniest abnormal liver test, should probably be checked at least once for hepatitis C, and that's that abnormal alanine aminotransferase level. If you've received a transfusion of blood or had an organ transplant, say a kidney transplant before 1992, we again know that that things weren't safe. We didn't know what hepatitis C was, so you have to be checked for that. Occupational exposure to hepatitis C positive blood, and of course children born to people with hepatitis C.
The video mentioned snorting cocaine as well. I mean, that's not a drug that uses needles, so why?
It's interesting, how do people get hepatitis C from snorting cocaine? As people probably know or figure out, is that the nasal passages are a great way to get drugs as well. And so you have blood in the field, so that when people use cocaine, they snort cocaine, there's a lot of bloody noses, it causes nosebleeds, and then you may be snorting positive hepatitis C blood from somebody else into your system.
Wow. Now, the first recommendation for screening are people sharing needles, correct?
Right. So, I mean, I wouldn't prioritize it first or not.
Okay.
I think that people, you know, it's the baby boomers for sure, and then everybody that's ever used needles, tattoos, blood transfusions before 1990. I think those are the big ones.